Physical dependence or mental compulsion. What exactly are we talking about when we're saying that someone might be addicted to a mood-altering substance? That's what we're going to get into here today. Let's go ahead and dive in. Hey everybody, I'm Jim Savage. Thanks so much for joining me here today. I'm a licensed drug and alcohol counselor, been working in the addiction treatment field for over 35 years. I specialize in helping individuals get sober. I also work with families. I have a program that's specifically designed for family members who are supporting a loved one in recovery. I also happen to be in long-term recovery myself. It's one of the ways that I got into this whole field. So again, thanks for joining me here. What we're going to talk about today is one of the first things that I think is important to clear up when we're going to have any kind of conversation about, quote unquote, whether someone's drug use is a problem or not. And that's the difference between physical dependence and mental compulsion. And so the first thing that I will say, a person can have a physical dependence on a substance and not be addicted. Just as well, a person can be addicted to a substance and not have a physical dependence on it. Not all drugs cause physical dependence. Okay, so let's take some examples here. A person is prescribed an opiate painkiller after a surgery, and they may take that or an injury or something. They take that for a while. It's possible that they will develop a physical dependence on that. And when it's time to stop taking it, the doctor will have to taper them off because they're going to experience some physical discomfort coming off it. Because the way the body reacts with the molecular structure of the chemical, it creates some physical discomfort. But because they develop that physical dependence, does that mean they're an addict? They need to start identifying as an addict and start going to NA meetings for the rest of their life? Probably not. Now, a little difference there would be if they sort of like the buzz that they get when they discover if I take a little bit more than the doctor's prescribing and I get that sort of warm, buzzy feeling, I sort of like that. And when it comes time for the doctor to start tapering the patient off, they sort of think, I like doing this, and they start doctor shopping to go find other prescriptions and continue to take that. That would be starting to move over into the realm of mental compulsion. That's not about that physical dependence. It's a mental thing that they sort of like this feeling that they get from changing how they feel. And they start with the compulsive behaviors. I'm going to engage in dishonest behavior by going to a different doctor, and they start that again. That's where we start to get into the arena of what addiction is like, that mental compulsive behavior. Now, let's go to the other side of the coin. Let's talk about drugs, that being addicted to a drug without having a physical dependence on it. Cannabis is the easiest example to give here. Cannabis does not cause physical dependence in the same way that opiate drugs do. We do not experience the same type of severe physical withdrawal symptoms when a person who's been using cannabis for a period of time abruptly stops. And that, I will submit, is one of the biggest contributors to denial, or let's say the misperception about you can't get addicted to pot. I have assessed hundreds of clients over the years who I can sort of tell they're probably going to come out as addicted to the pot, but they tell me I'm not addicted. They are steadfast, they are dug in. I am not addicted, because they'll say, I can quit whenever I want to. And then the next thing they say, I'll say, so have you tried to quit before? Oh, yes, I can quit whenever I want to. I've quit lots of times. That right there is sort of a little wonky kind of statement, right? I'm going to quit, but then I start again. That's sort of the problem, is the starting again. But let's just say they go for a period of time or going on vacation and don't have any access to cannabis for a couple of weeks. They don't go through the shakes and the body aches and the writhing on the floor in pain, and it's no problem. And so they equate that with, see, I'm not addicted. But what we have to understand, again, is it's not about the physical dependence, it's about that mental compulsion, which is more about the thinking about it, how we think about it, how much time we spend thinking about it, and how we allow it to impact our life. And some of the words that we use in describing when we're assessing whether there's an issue or not, we use words like preoccupation, thinking about it outside of the actual use. That's sort of, moving in the direction of mental compulsion, glorifying it, talking about how much I'm in love with my cannabis. Okay, that's starting to get into the realm of mental compulsion kind of stuff, and especially when we start allowing the use of it to influence decisions that we make. I'm not going to go to the grandparents' 50th wedding anniversary because I'm going to go out and spend time with my using buddies, and really what's driving that bus is I want to get high instead of going to do something else, putting off important responsibilities. That's more mental compulsion. It's not about the physical need to do that. So again, it is really important, especially, cannabis is in my experience the most common substance that people can get misinformed about, with thinking that they're not addicted because it doesn't cause the physical dependence. Alcohol is going to be similar in that alcohol, you can definitely get some severe physical dependence to it, but it happens a lot slower or over a longer period of time compared to the opiates. Again, you can develop the physical dependence pretty quick with opiates, not quite as much with the alcohol dependence. But you can definitely, alcohol dependence can be dangerous and severe in the withdrawal with it. But again, the main message I want to stress here is just because you don't have a physical dependence to the substance, and I think that that's actually what most people have an image of when we think about whether a person has a quote-unquote problem or not. Are they addicted or not? And lots of times family members of the cannabis user, they don't see them shaking, or they don't see the severe, body deterioration, those kind of things. And so they think that there must not be a problem. I actually once had some parents tell me, we realize there's probably an addiction, but we don't think there's a chemical dependency. And that was a good example of their thinking. When they said, we realize there's probably an addiction, they were probably referring to the signs of compulsive behavior. How they're, I don't remember if it was a son or it was a daughter, I think, how, they're compulsive, want to go be with their friends instead of doing this thing. And on some level, they have a hunch that it's got something to do with using, that desire to be around the using. And that's what they were recognizing or characterizing when they said, we realize there's probably an addiction. But then they said, we don't think there's a chemical dependency, because they weren't seeing the shaking and the tweaking and, that type of thing. And the unfortunate thing is that leaves in their mind that it's not as bad, it could be worse. And they disregard, if say I give a recommendation, your daughter's addicted and needs to go into treatment, they may think that's too severe. Again, that's a pretty common one. Rehab just for pot use, well, it's not about the chemical, it's about what's going on mentally. And that's, again, a whole different area. So again, just to recap what we've talked about here today, not all drugs cause physical dependence. Some do, some don't. But a person doesn't have to have a physical dependence on a drug to be addicted to it, just as someone who has a physical dependence is not automatically addicted to it. It's more about looking at what's going on in the mental compulsion, how we regard our attitude, how much time we spend thinking about the using, and how it influences our behaviors. And again, not just to keep away from the severe withdrawal stuff. That's understandable. Lots of times people on, certain drugs, they keep using it because they're afraid of the withdrawal. That's understandable. So again, it's more about the compulsion and looking at what's going on. Hope you got something out of this. Please do me a favor and leave hit the like button or subscribe to the channel. That's a way of helping get this message out to other people who might benefit from hearing it. I appreciate you taking the time to listen today, and I'll see you in the next one. Bye.